Assalamualaikum everyone. My name is Saiba Asif, and on behalf of my group, I'll be explaining hypertrophy today. I'll start with introduction to hypertrophy, which is a condition in which the cell increases in size, leading to an increase in the size of the tissue or an organ. It is different from hyperplasia, which is increase in the number of cells. We have three examples of hypertrophy: muscle, uterine, and cardiac. Muscle hypertrophy is due to physical exercise or strength training. Uterine, we have example of pregnancy in which the uterus undergoes significant enlargement to accommodate the growing fetus. And in cardiac hypertrophy, we have two. One is physiological from exercise, and another one is from pathological from high blood pressure or any other disease. We have four types of hypertrophy. One is renal hypertrophy, the other one is cardiac hypertrophy. In renal hypertrophy, increase in the kidney size, and in cardiac hypertrophy, we have enlargement of heart muscle, which is myocardium. Then the other two examples are hepatocyte hypertrophy and the HPOA. Hepatocyte hypertrophy refers to increase in the size of liver cell, while HPOA stands for hypertrophic pulmonary osteoarthropathy, in which there is an inflammation of bones and joints, particularly in the wrists and ankles. Now I'll start with the gross appearance and microscopic finding. We have example of hemochromatosis first, which is an accumulation of excess iron, which can lead to heart enlargement and dysfunction. The second one is left ventricle thickness, which is over 2 centimeter. This is typically due to the hypertension. The last example is of skeletal muscle hypertrophy. We can see over here the myofibril are increase in diameter, which can lead to the internal nuclei and structural changes like splitting or clefting. Over to functional implication. We have already known the physiological hypertrophy and pathological hypertrophy. Physiological hypertrophy is due to the accommodation, while the pathological hypertrophy is due to any certain disease. The functional implication has four examples. The first one is hypertrophy of cardiac muscle, which can be occur in number of cardiovascular diseases. The second one is hypertrophy of smooth muscle, which we have cardiac achalasia in esophagus, pyloric stenosis in stomach, intestinal strictures, and muscular arteries in hypertension. The third example is hypertrophy of skeletal muscle, which is hypertrophied muscle in athletes and laborers. And the fourth one is compensatory hypertrophy, which may occur in an organ when the collateral organ is moved. Example, when one kidney is moved, the other will grow large to accommodate the function of the first kidney. Hypertrophy has following complication. The first one is cardiac hypertrophy complication, which can lead to cardiac death. The second one is skeletal muscle hypertrophy, which is an increased risk of muscle injury or strain. And the third one is smooth muscle hypertrophy, which we include bladder, which can lead to urinary retention. The other one is hypertrophy and hypertension, which can lead to the thickening of heart muscle, requiring more force to pump blood. The other one is thromboembolic events, which is increased risk of clot forming in the enlarged atrium, leading to strokes. And the last one is organ-specific hypertrophy complication, like in kidney or liver, hypertrophy can escalate the chronic disease like kidney failure or cirrhosis. We can diagnose hypertrophy by imaging technique. The first one is ultrasound echocardiography, ultrasound of the heart. The second one is magnetic resonance imaging, which is detailed imaging with magnetic field. The third one is CT scan, which is X-ray based cross-sectional imaging, when it is used when MRI is not suitable. The fourth one is chest X-ray, which is basic imaging of thoracic organ. We have four treatment options for hypertrophy. All these depend upon the hypertrophy area. The first one is medical treatment, which involve hormone therapy, anti-inflammatory medication, pain relief medication, and antibiotics. The second one is surgical treatment. We can reduce the size of the affected area, we can restore the function, or we can remove the abnormal growth. The third one is alternative therapy, which includes the massage therapy, acupuncture, and physical therapy modalities. And the last one is specific treatment option for different type of hypertrophy. For example, for muscular hypertrophy, we can use training and physical therapy. For cardiac, we can use like blood sugar and blood pressure management. And for prosthetic hypertrophy, we use medicine to reduce prostate. For prevention, the first thing we can do is lifestyle changes, which includes exercise, going for healthy diet, maintaining a weight according to our BMI, and managing stress. The second one is specific prevention strategies, like which involve, like for example, muscle hypertrophy. We should avoid overtraining. For cardiac hypertrophy, we should manage blood pressure, cholesterol, and blood sugar. And for prosthetic hypertrophy, we should maintain a healthy diet. The other preventing measures include regular checkup, avoid smoking, and limiting alcohol consumption. And if you have family history of hypertrophy, we should go for genetic testing and hormonal regulation. Thank you so much for listening. That was all.